Hello, my name is Eddie Love. Welcome to A Reasonable Agenda. First, I would like to thank Randy Brewer and Debbie Heavey. I would also like to thank Aaron Bolio and Matt Makris for allowing me to do this today. We are recording this live from the Natick Pegasus studio in Natick, Massachusetts. I would like to take this opportunity to talk about our dysfunctional healthcare system. I am not a politician or a journalist, and I don't plan on seeking a career in those fields. I am a U.S. citizen who works and is fortunate to have healthcare coverage, but with a very high deductible. The truth is, over 40,000 U.S. citizens die each year because they are either uninsured or underinsured. And folks, I am a registered independent, and like most Americans, because like most policies, the Democratic Party baits us with a plan to fulfill our needs, and somehow are so bipartisan with fellow members of the Democratic Party, they'll negotiate the bill down to a microscopic fraction of the needed package and slap a bunch of corporate subsidies on it. In this case, it's universal health care. During this program, I will be covering specifically what is dysfunctional about our healthcare program based on purely sourced material and indisputable facts. I will be talking about Medicare for All, written by Senator Bernie Sanders. Exactly how it works, what it covers, and how it is funded. The popularity of universal health care actually begins in the late 1800s when various coalitions and political campaigns were ambitious to fund health care, as some Europeans were already headed in that direction. But it wouldn't be until 1901, when Theodore Roosevelt took office, when the idea became a vision of a sitting president for the first time. A man who believed, and I quote, "No country could be strong whose people were sick or poor." This was back when Republicans were ambitiously liberal and rallied around meaningful agendas that would be considered left to the status quo of their time. Unfortunately, Teddy Roosevelt was succeeded by relatively conservative presidents for another 20 years until the idea would be center stage again. President Franklin Delano Roosevelt would expand on this vision to revolutionary proportions with the Second Bill of Rights. The Second Bill of Rights guaranteed everyone health care, a job, an adequate wage, and a decent living, a decent home, a good education, and economic protection for sickness, accident, old age, etc. FDR was very ambitious and was voted in 4 times due to his popularity. Sadly, the agenda was just too ambitious for the status quo of the time. President Roosevelt would eventually die in office, and his vision remains mostly unfulfilled. In the 1960s, John F. Kennedy would give life to the idea of universal health care again, but exclusively for those who needed it most, like the elderly and the disabled. His successor, Lyndon B. Johnson, would ultimately sign a bill just like that into law, and goo goo gajoob. That was the birth of Medicare, which will become the most popular and most widely used healthcare program in the United States to this day. Although the bill was not flawless, it was a major milestone in social economics in the U.S., despite our out-of-pocket expenses. This became a very successful example of government-funded health care on a smaller scale. But by the end of the 1960s, Robert Kennedy would begin to campaign on expanding universal health care, as others after him would go on to do. But the problem was the healthcare industry became way too profitable. With big money influences. It was influential on politicians, such as Ronald Reagan, Barack Obama, just about all of them we've voted in the past 40 years. The goal seemingly went from make healthcare a basic human right to protect the private sector. This is what corporate socialism looks like. Eventually, the rise of the Affordable Care Act became the new agenda and has successfully passed as law of the land, which is not popular at all. The Affordable Care Act, at least in its infancy, was a Republican bill. It's now known as Obamacare. The leaders of the Democratic Party have sold people the narrative of universal health care, with a very expensive program that is designed to appease their corporate donors. Now here comes the heavy fact we all need to take in. Healthcare CEOs in the United States are collectively making $100 billion per year on healthcare. That takes another $700 billion in administration costs just to maintain the profiteering of healthcare. Meanwhile, our current president, Joe Biden, claims we cannot do what 43 other nations are able to do: healthcare as a human right. Take a look at this graph. Now notice, every place in green has established universal and free healthcare. The United States is one of the bare minimum exceptions in the world where healthcare is neither universal nor free. But why? We have a country full of politicians and media correspondents who insist we cannot afford a single-payer program. Is this because it would end the profiteering of healthcare in the United States? Well, who knows? Okay, so there seems to be some momentum on these issues, like this one in the Democratic Party. But how come not one elected Republican senator or congressperson is in favor of government-funded health care, when half of their constituents are in favor of it? The truth is, most elected Democrats align with the Republicans on this matter. They simply don't represent the needs of the people. Sadly, the Republican Party is still being hijacked by a populist movement campaigned by Donald Trump. And there are no signs of there being a progressive or liberal Republican in the near future, which makes bipartisanship with them very difficult. The true battle is between the American people and the Democratic establishment, the largest majority party. Although the mainstream news media never wants to bring it up, Medicare for All is by far the most desired healthcare program. 87% of registered Democrats are in favor of Medicare for All. You can look up any major polling data and you will get a number just like that. And on top of that, up to 49% of registered Republicans are in favor of Medicare for All, and that popularity is still growing. When you include independent and third-party voters, a total of 69% of American voters want Medicare for All to be passed as law. In my own opinion, that number will only grow, but I'll save any further opinions to the end. Let's get down to the facts. What is Medicare for All exactly? It is literally Medicare, which is already established and functional, which actually makes it pretty ethical to expand upon. It would be 100% government funded and guaranteed to all Americans as a civil right. This would guarantee zero out-of-pocket expenses and surprise billings, no co-pays, no deductibles, no premiums. This covers virtually all healthcare needs, including general health, mental health, eye care, dental. Remember, this covers the costs of hearing aids, dentures, and eyeglasses as well. However, there are carefully placed provisions to avoid coverage for things like personal cosmetics and plastic surgery that is not linked to an imminent health risk. Under Medicare for All, Medicare will finally be able to negotiate their own drug prices for prescription drugs. However, as far as medication goes, there could be out-of-pocket expenses for a certain medication. Out of all out-of-pocket expenses, about $200 per year would be the cap. No one would be spending over $200 per year for their prescription needs, any and all. All Americans will be automatically enrolled once enacted. No paperwork, no plan comparing. Anyone can theoretically opt out, and I say theoretically because most people in their right mind wouldn't be compelled to opt out of their own right to see a doctor. Healthcare is not a consumable product, it is a civil right. Will taxes go up? Well, yes, taxes will go up, quite frankly. Anyone making over $30,000 a year would pay an extra $40 on top of the taxes they already pay now. If you make less, you wouldn't be taxed at all. But if you're making six figures or more, you're going to be paying at least $2,800 per year, which is a little less than we all already pay anyways. The very richest in this country, the top 1%, would be paying over $18,000 per year in taxes. But why the hell would it be okay to raise our own taxes at all? Is that not a foolish idea? Well, under Medicare for All, the incentive is more valuable than the price tag. The average U.S. citizen will be saving $12,500 per year. How do I know that? Well, according to the Peter G. Peterson Foundation, Americans spend $12,500 per year on health care costs. Your average business owner pays over $14,000 per year. Now, obviously, the challenge ahead of us is corporate greed and corporate-funded elections. It would take campaign finance reform and a lot of votes, specifically in primaries, where the nominee is chosen for any given office. But corporate-funded bureaucrats protecting their special interests is a very hard thing to compete with democratically, while it's still legal. These political sharks exist in both major parties, and they are the only thing standing in the way of single-payer health care, like Medicare for All, from passing in the Senate. A great example is a Democrat named Joe Manchin. Joe Manchin is a senator from West Virginia who is credited to destroying the Build Back Better plan of 2021. These people will always sell themselves as moderates, but in Manchin's case, he has at least 25 billionaire donors and gets much of his money from industries like the hospitals and nurses, gas and oil, mining, hunting, gambling, tobacco. So how exactly will we pay for Medicare for All? It's expensive, right? Well, compared to what? Our current program. Well, based on our current program, the sources I've found, citizens.org is a great place to look up. Our healthcare spending is expected to continue rising and will reach $6 trillion per year by the year 2027. That means, according to the federal government, we will be spending around $42 trillion on healthcare within the next decade. Remember, at the same time, healthcare in the United States is rising over $100 billion in profit annually. So is Medicare for All cheaper to operate than the Affordable Care Act? The short answer is absolutely. But don't just take my word for it. There are plenty of studies on the matter out there, and I encourage you to research for yourself. But one of the most compelling studies come from a very unlikely source. The Koch brothers. The Koch brothers attempted to derail Bernie Sanders and derail his movement by funding a study to determine how expensive his healthcare program, Medicare for All, would cost. And guess what? It backfired. Their study concluded that we would save around $2 trillion in a period of 10 years if we repealed the current program and replaced it with Medicare for All. This bill reallocates a lot of wasteful spending and simply funds all expenses more efficiently than the Affordable Care Act. This is a very comprehensive repeal and replace bill. The fundamental question is, should we continue with the Affordable Care Act for the sake of protecting the private sector? Do we really care about what the logo on our card looks like, our healthcare card? Are we content with the endless paperwork? The confusing ins and outs just to see a physician? Or should we join the rest of the world by making healthcare a human right? Over 31 million Americans today are uninsured disproportionately. It is people of color. This attributes to the observable systemic racism that is built into our very system itself. At least 9 million children, any parents out there? At least 9 million children are uninsured in the United States. Millions of other Americans are underinsured. Meanwhile, a handful of billionaires are making hundreds of billions of dollars in profit each year off of the most chaotic healthcare system in the world. I encourage viewers to look up the bill, Medicare for All, written by Bernie Sanders. It is not a blog. It is over 100 pages of detailed legislation. And there's no networks, no premiums, no deductibles, no copays, no surprise bills. If you would like to get involved, being an activist is very easy. You can visit www.medicareforallresolutions.org to join the fight. You can also bring this fight right to your community. That's right. Just check it out. There are tutorial videos and training videos to get you started. If you sign up, you would be provided a user-friendly network. Local governments can help shape the national narrative that we need to join the rest of the industrialized world and make healthcare a human right. Of course, activism is not for everyone and not the expectation of this program. We should normalize talking about these difficult issues with friends, family members, and even perfect strangers. But I'm about to introduce someone who's not a stranger, but a good friend of mine, a spiritual leader of the Commons Street Spiritual Center and also director, fellow humanitarian, Dr. Ian Mevorach. Thank you for coming.
Eddie, it's my pleasure.
Thank you.
Yeah.
I would just like to start this note on how difficult it is for the average person to talk about our ideologies like Medicare for All.
That's an important point. I think we're living in this very divisive time where politics are so polarized that it's hard to bring up conversations like this without immediately going to a place of extreme disagreement, where then people say, I don't know how to maintain a relationship with someone who sees it differently. And I think, for me, part of how we get through is by trying to talk about, not always talking about so much about the politicians and who we support, this one or that one, but trying to talk about the society we want to have and to be able to have a conversation about how do we want to see our world. And I think when we get to the realities of people who can't afford health care and what that looks like in their lives, because oftentimes it's people who really are hardworking people, and let's say you get stricken by cancer, you're right in your stride in your 50s maybe, paying all your bills and doing fine. Now all of a sudden your medical bills are going to go way up, and you're going to become indebted with medical debt and shocking bills. And it's just so much for a person or a family to go through that. You're at death's door, or maybe you even die from a disease like this, and all your money is gone as well. And now you're also struggling with poverty as well as illness, which when we look at those things, and we see the suffering, that's where I think people could come together and say, we don't want to see this level of suffering. Then we could talk about how we prevent it and how we move forward. Rather than making it about whether Republicans are right or Democrats are right, more abstractly about kind of like the tribes that we're in. But if we could focus more on the realities.
But how does one begin that conversation with their uncle, who is very important in this country because their vote counts, their words matter, but they do not believe healthcare is a human right? Do we give up on those people, or do we keep planting seeds?
We have to keep planting seeds. We have to listen to people who we don't agree with, too. So, if someone says they don't think healthcare is a human right, that's a good time to ask another question and say, well, what do you believe? Or, and keep asking questions to let them share their truth. Because I think there's like a place below the strict talking point of yes, no. There's something deeper than that. There's a truth that every person has. And maybe it's, about freedom or something. And so someone maybe, that's their big value. So they're like, I'm not sure if the government controlling healthcare is compatible with freedom. And, maybe if you get deep down, you get to that. But then there's a way to talk about that and talk about, well, are you really free if you get sick and then you go broke and then you're in debt, and then is that freedom, or is it more free if you don't have to worry about paying healthcare?
Well, what I believe is that humans define freedom. We define what a human right is. Nobody likes talking about these things. And if any of my friends are listening, I want to let you know that when we do pass Medicare for All as law, I will promise to shut up about it. But until then, I'm not going to shut up about it.
Conversation, especially with someone you disagree with, there needs to be a relationship. If there's no relationship and you're just on social media and it's just a head, that's something that, there's not a basis for holding the disagreement. When you're in a disagreement, it's like the relationship has to be stronger than the disagreement. So if it's your uncle, if it's a friend, you know, it's the friendship, it's the relationship that opens the space for them to listen to you. They listen out of respect, even if they disagree with what you're saying. And then you have to listen to them. And the exchange of disagreeing information can be awkward. And you don't have to look to try to win a person over in one conversation. You just want to share your truth. And if they listen to you and you listen to them, that's communication. And one thing I would say is, you know, young people are very excited about Medicare for All. And,
highest demographic.
Yeah, and I think young people, you know, see the future and they don't want to live with the same level of financial stress that they have now. This is one of the biggest problems in our society, is that people are too stressed financially. They don't have the kinds of job opportunities they would need to pay for a decent life. And that creates this cycle of hopelessness, depression, drug addiction. All of these things are fueled by, you know, a society that's just too challenging in the way it's set up. So young people want to see the game change. And I think that, you know, we need to have an intergenerational movement, but we especially need to reach out to young people and empower them and let them know that if we really work together, we can change the society in a way that will make it more compassionate, in a way that will make it less stressful. Because right now, young people don't have a sense of hope, and they've really given up that they're going to be able to make a difference.
Yes.
But like, you know, like you showed in that history explanation, these aren't new ideas, and people have been excited about these ideas for, you know, at least a century. Sometimes in a society, it takes a century. It takes a century and a half to get a big change, you know, and to shift our values. But we really want a society where people are valued more, where their dignity is more respected. And that, I think, if we get young people excited, you know, Uncle Joe will be excited because of, you know, his niece and nephew, because they really want it, because they're hopeful. And I think, you know, there's an intergenerational aspect there that maybe we haven't fully seen. But, you know, maybe if young people talk to their elders and ask them.
And here's the good news. I would like to just say a couple of good news. The good news for all my young viewers, and young viewers being viewers younger than myself, because anybody older than me is very old.
Now, what does that age?
But anybody there in their 20s, just eligible to vote, you outnumber the generation that's over the age of 35. And we could have outnumbered them in past elections, but we definitely can outnumber them in future elections. Remember, demographically, programs like Medicare for All are overwhelmingly popular with the millennial generation X, Y, and Z. And the other good news is Medicare for All isn't going anywhere. That bill will be on the House floor over and over and over again. We have an opportunity to fight for this bill in the future. It's important to have your voice heard, and if you do have an opportunity to speak your voice, I think the worst lesson the older generation has ever taught our generation is to not talk about politics. And
I agree with that. You know, there's a growth of effectiveness, and we have to figure out what language to use, how to speak with people, how to listen, how to build a movement, and how to actually achieve these goals. If you really get to it, they want to see everyone have health care. They're really not interested in seeing people sick and struggling.
If you would like to join our movement or find out more or even make a donation, you can go to berniesanders.com and find out. Thank you very much, and have a good day.